We are Group 5, and this is our presentation on hearing impairment. So what is hearing impairment? IDEA defines hearing impairment as an impairment in hearing, whether permanent or fluctuating, that adversely affects a student's educational performance, but is not included under the definition of deafness. So this means that while a student may have hearing troubles, this category does not include students who are completely without hearing or deaf. Typically, deafness is defined as hearing loss above 90 decibels, so hearing impairment is loss below this 90 decibels.
Some causes of hearing impairment. First, we'll go through the causes of conductive hearing loss, which some are the malformation of the outer ear, fluid in the middle ear infections, allergies, poor eustachian tube function, perforated eardrum, tumors, impacted earwax, infection in the ear canal, foreign objects in the ear, or osteosclerosis. There are also causes of hearing impairment for sensorineural hearing loss, which is exposure to loud noise, aging, head trauma, virus or disease, autoimmune inner ear disease, heredity, malformation of the inner ear, Meniere's disease, also autosclerosis, and also tumors.
So some of the treatment of hearing impairment. The treatment depends on the type and the cause of the hearing impairment. For those with conductive hearing loss, surgery or hearing aids are usually the best treatment. And for sensorineural hearing loss, treatments include corticosteroids, surgery, hearing aids, cochlear implants, or medicine to help control it. The most common treatment is the use of hearing aids if it can't be helped through surgery or medication.
So the effects of hearing impairment on development, it causes delayed speech and language skills. It can cause learning problems in school, low self-esteem, and they may struggle socially in making friends. And then they can have health impacts such as headaches, muscle tension, and high blood pressure from stress.
Okay, so help for those with hearing impairments. There's assistive devices for people with hearing impairments, which are ones we've spoken of before, like the various assistive listening devices and hearing implants and aids that will help people with partial hearing loss. And then there's also alternative communication. There's many different forms of alternatives for people to be able to communicate and understand what's happening around them. Like sign language is probably the most common, like understood form of communication. And then there's also lots of apps that are created today that can help students in the classroom and in public settings for those that are hearing impaired. And these are really useful because it's more accessible and affordable ways for like them to be able to communicate.
Okay, so if you don't have a professional to help you out in the classroom, it's important to keep those with hearing impairments close to instruction. Also to keep it uncomplicated and repeat instruction. Also make sure the definitions are clear and that examples and visual aids are offered for the students, whether that be a chalkboard, overhead, PowerPoint, handouts, etc. And make sure to demonstrate and explain information through example. And when teaching and when students are interacting, make sure to gesture and make obvious when talking to a student and repeat comments and questions for students. Acknowledge those students that are making the discussion and face the classroom, obviously, when speaking.